Here's a story on Natural News.
U.S. military preparing to implement medical martial law due to coronavirus pandemic Sunday, February 16, 2020. The Joint Chiefs of Staff, JCS, has issued an executive order, EO, calling on the United States Northern Command to start preparing for a full-blown pandemic of the Wuhan coronavirus, COVID-19, here on American soil. According to a service-wide message issued this past week to the Navy and Marine Corps, Defense Secretary Mark Esper has officially approved the EO, which orders commanders to get ready for widespread outbreaks of the Wuhan coronavirus, COVID-19. They're also reportedly being told to prepare for having to forcibly confine service members with a history of travel to China. Similar to what Communist China is doing by implementing medical martial law, the U.S. military under President Donald Trump is implementing what's known as the Department of Defense Global Campaign Plan for Pandemic Influenza and Infectious Diseases 3551-13, which the Military Times describes as the Pentagon's blueprint for planning and preparing for widespread dispersion of influenza and previously unknown diseases. U.S. Northern Command has indicated that it is now directing the Joint Staff to commence prudent planning based on its assigned role to synchronize the department's various plans for handling a pandemic, flu or similar disease. At the same time, it also added that this planning does not necessarily indicate a greater likelihood of an event developing. As military professionals, planning for a range of contingencies is something we owe the American people, stated Navy Lieutenant Commander Mike Hatfield in a statement. We coordinate with other competent commands to assess potential impacts in the event of a pandemic, and we ensure the U.S. military is poised to respond as required. The military profession fosters a culture of planning, and the fact that we are coordinating planning efforts across the geographical competent commands is consistent with how we prepare to respond, if directed, he further added. Mike Adams, the Health Ranger, discusses how the Wuhan coronavirus, COVID-19, is shaping up to be an infamous black swan event that has the very real potential to take down the global economy.
So what if you show up one day in Walmart and half the shelves are empty? You would probably freak out, like, what's going on here? Well, what's happening is that most of the goods at Walmart come out of China. And right now, there are ships on the way from China that will restock Walmart for the next few weeks. Because it takes about, maybe 3 to 5 weeks to get goods from China to the shelf of your local Walmart. So there's about a 3 to 5 week buffer of supply lines that's already in process. But a lot of exports have halted now because the factories are shut down because everybody's quarantined. Now, not everywhere in China, but in a lot of regions, and the quarantine is expanding. According to many reports, there are as many as 400 million people in China that are under restrictions or quarantines or voluntary lockdowns or various forms of that, and a lot of factories are not running. So after the current ships sailing across the Pacific Ocean unload their cargo that goes to the store shelves in Walmart and Target and Costco and everywhere else, there's going to be a gap. That gap is going to be maybe months. It's hard to say. By some estimates, this virus will peak in March in the Wuhan region, and it will begin to fall, and we might be able to see businesses reopen sometime in late March. I'm not sure, but clearly this is going to be maybe about a 2-month disruption if that's a good case. If it gets worse, if the outbreak continues, and if there are repeated infections from the same people, we've seen cases of that where people somehow get reinfected even after they've been cured, so to speak, after they've recovered. If that happens a lot, we could be looking at a shutdown lasting many, many months. This is going to affect not only
U.S. military preparing to implement medical martial law due to coronavirus pandemic Sunday, February 16, 2020 by Ethan Huff tags, Chaos, China, collapse, coronavirus, disease, global emergency, martial law, medical martial law, military, novel coronavirus down the global economy. Is the U.S. military expecting its own Wuhan coronavirus, COVID-19, outbreaks at its various installations? According to Marine Corps message Maratman 082/20, commanders throughout the U.S. military are being told to review their disease containment plans and take all necessary preparatory and precautionary actions to protect all of its service members, installations, and ship stations around the globe. Part of this includes ensuring that all plans for containment procedures are assessed from response to isolation to quarantine to restriction of movement and community-based intervention, according to the memo. The Marine Corps, it further adds, has to be able to mitigate, respond to, and recover from the effects of the Wuhan coronavirus, COVID-19, in order to maintain force readiness.
And here are the bases where the quarantines are being conducted here. Pearl Harbor, Hawaii, Great Lakes, Illinois, Naval Air Station, Fort Worth, Texas, Dobbins Base, Georgia, Fort Hamilton, New York, Kensap, Washington, Joint Base Anacostia, Washington, D.C., McGuire, New Jersey, Fort Custer, Michigan, March Base, and Travis, California. And then another one's been added. Let's see. The Lackland Air Force Base in Texas, Fort Carson, Colorado, and the Marine Corps at Miramar, California. South Korea says it's successfully treating coronavirus patients with the natural oxygen therapy.
In a breakthrough for eradicating the Wuhan coronavirus, COVID-19, South Korean officials have successfully treated a patient using all-natural oxygen therapy. Unlike our own Centers for Disease Control and Prevention, CDC, which only advocates for pharmaceuticals and vaccines, Korea's CDC effectively cured, dare we use that word, a patient by delivering oxygen through a face mask, according to the local news service Newses. Jong Eun Kae-yong, director of Korea's CDC, announced that only one of South Korea's 21 remaining Wuhan coronavirus, COVID-19, patients is still in critical condition, while the rest have been released. As for the oxygen therapy, Zhang explained that it effectively saturates a patient's body with oxygen by delivering high doses of it. And as we've reported in the past, diseases of all kinds hate oxygen and simply can't survive in its presence.
Here are 75,000 total confirmed cases based on the data from the WHO and the CDC coming out of China. Total deaths over 2,000. Total recovered 14,772. If we look at the worldometer, as it's correctly pronounced, we can see here there's active and inactive cases. Closed cases 16,814. 88% of those have been recovered or discharged, and 12% deaths in the closed cases so far. Of course, these numbers are underreported. To end this update with an excellent article that was published on the 12th of February 2020 on the practical recommendations for critical care and anesthesia teams caring for novel coronavirus patients. And I will put a link in the description below. This article that is written in Canada talks about their experience with the SARS virus back in 2002. And it talks about very practical things to do, for instance, in the intensive care unit, what kind of personal protective equipment to be wearing, how the flow of air in these rooms, whether or not they're negative or positive pressure rooms, are very important. For instance, if you are doing, generally speaking, an operation that's in an operating room and that room is run under positive pressure ventilation, something that, of course, you would never want to have happen if you're doing an operation on somebody with this kind of virus. And so they talk about switching those kind of patients into negative pressure rooms to do the operation so that you don't infect other people in the hospital. And so I think it's an excellent read for physicians, healthcare providers who are going to be taking care of these coronavirus or COVID-19 patients. It also talks about when to use N95 masks versus these powered air purifying respirators, otherwise known as PAPRs, and who should be wearing them, and talking about, for instance, hot zones, warm zones, and cold zones. Hot zones being in the patient's room specifically, where there's negative pressure ventilation. Warm zones when you're outside the patient's room but still in the intensive care unit. And then finally, cold zones when you're outside of the intensive care unit.
So far we've been able to contain it, but I think this virus is probably with us beyond this season, or beyond this year, and I think eventually the virus will find a foothold and we will get community-based transmission, and you can start to think of it in the sense like seasonal flu. The only difference is we don't understand this virus.
Which is exactly why the CDC wants to be on the ground in China. It's probably Redfield's biggest frustration.
Right now there's no evidence to me that this outbreak is at all under control. It's definitely not controlled, and the sooner we can help them get it under control, the better for the whole world.
So I guess that does raise the question, why are we sitting here in Atlanta talking about this versus